Consumer engagement is important because it's the right thing to do. It's right to get people involved in decisions that affect them, and importantly, healthcare has ramifications across an entire person's life.
The Patient Reported Measures program is a key enabler of the New South Wales Health Integrated Care Strategy. The Patient Reported Measures program enables patients to provide direct, timely feedback about outcomes and experiences to their healthcare providers about things that are important to them.
Patient-reported measures are essential for a successful relationship between patient and their healthcare provider, because it allows the doctor or other provider to know what is important to the patient. Therefore, in a consultation, you don't miss the important issues and you see the connections between what you want as a clinician, but also what they want as a patient. Someone is always far more than the condition you are treating them for. And that is the power of these measures, to let you know as a clinician the other issues you may need to deal with to successfully interact with this patient.
Yeah, I think that the international evidence suggests if planned properly, this patient-reported outcome definitely is feasible to do, and it can be a great contribution to healthcare improvement to patient management, such as like Sweden. They have currently they have more than 100 different healthcare improvement quality registry, which is actually routinely collecting patient-reported outcome. By and large, and the evidence all suggests through the systematic review and routinely collecting this patient-reported outcome, it will improve communication between doctor and the patients. Okay, improve the engagement of patient in the decision making. Also, improvement in the self-management. Particularly for those patients that have a multi-comorbidity, have a chronic disease, elderly patients, it's improve their self-management. There also growing evidence now to support if you do that properly, it can improve patient health outcome as well.
What's important to a patient is how they can play with their children on the weekend, how easily they can make themselves a cup of tea, how quickly they're going to be able to get from hospital back to home. What patient-reported measures do enables us to really try and hone in on those things that are most important to patients, so they're more likely to be committed to following a treatment and medication plan, leading to them to achieve their goals quicker.
Many doctors do their utmost to record patients' interests and concerns as it stands. What this system offers you is a deliberate and a recorded way to make sure that you cover off the issues that may not be immediately apparent to you as a clinician. And equally, if you present a patient with a document before a consultation, that will also prompt them to think about what issues are important to me that I might not think to raise with my doctor, but on reflection perhaps I should, and that will cause them to speak to you about the family issues that will impact on their treatment, or whether they entirely agree with you that this particular condition amongst the many that they might have is their most important concern, and if treating it actually presents them with more problems than medical solutions. Had patient-reported measures been more important in the past, personally I would have made a lot of different decisions about various treatments and orthopaedic procedures that I undertook, which in retrospect didn't hold the outcomes or the promises that were initially made for them.
We know that people go into healthcare to make a difference to people's lives, and despite some time constraints and other barriers, most clinicians do their best to really tailor consultations and seek the best information to tailor care to people's needs. What patient-reported measures offers is a structured approach to collecting information that will make a difference to that patient and to the treatment and care that they receive. This can then be used at a service level to inform improvements and at a system level to ensure that population health outcomes are improved. Providing methods and focused time for clinicians to really engage at a deeper level with consumers and patients. Being able to use that data can also enable the tailoring of care so that consumers can receive care that better meets their needs and enables better health outcomes and more healthy behaviours.
I think that individually there will be an improvement for the patient and their doctor, but generally if we can keep people healthier for longer by helping them avoid major traumas, by helping them avoid major hospitalisations, by using a very deliberate process of patient-reported measures, then we will have positive health outcomes, lower health costs, and that will be a general benefit for all of us.